As antibody testing ramps up, we learn more about how the results can aid the state's response to the pandemic from university researcher and immunologist Deepta Bhattacharya.
One of the most important things is it'll give you a sense as to how widespread the virus is within our state and within local communities. As we know, it's very different between somewhere like New York City and somewhere where, like Arizona, in which the wave is substantially later. So I think that's the most important and tangible piece of evidence that we'll get. We'll also start to get quite a lot of evidence in our questions on how long does immunity last? How long do you produce antibodies for after you've been exposed to the virus? And then, unfortunately, once the second wave hits, I think we'll get a little bit of a better sense as to how many antibodies do you actually need to protect you from getting reinfected. And so these are all really important questions, and we have to get a baseline level of seropositivity rates and antibody levels.
Let's say people do the test for the antibody. I'm not asking so what, but then what? Does that mean I can go into a grocery store and I don't have to wear the mask or the gloves?
Yeah, I mean, it's a good question. And there are a couple of different ways you can approach that question. You can approach it from the standpoint where we assume nothing about this virus and we need to learn everything. I'm really more in the camp that we should learn and start as our baseline all the things that we've learned from viral immunology over the past 50 years, which is that if you've been exposed to something, an acute viral infection, and you've cleared it, you're almost certainly at reduced risk of getting infected again. So almost certainly you would get less sick than if you had never seen it at all. Now, there's a lot of nuance to that, though. I mean, how many antibodies do you have to truly be fully protected? And those are unfortunately not the answers that we have, and we probably won't know until that second wave hits.
What about this concern over false positives?
Yeah, that's a huge concern. And, I think one of the things that we've been learning as we develop this test in Arizona, because the wave has hit here a little bit later than some of the others, is really looking at some of the data that's been coming out of other tests. And certainly we've seen a lot of concern with the inaccuracy of some of these tests, particularly the finger prick tests. And so the FDA, as some of the viewers may know, issued some new guidelines over the past week to make sure that the tests are actually working as they should. Ours is not a finger prick test. It basically requires a blood draw and sending those samples back to the central labs here at University of Arizona. So the big difference is that our test produces a number, and that allows us to set very strict statistical thresholds to make sure that we're not getting very many false positives. That does come at the expense of false negatives, and we decided that that was the lesser of two evils, so that if you have some low levels of antibodies, there's a reasonable chance that our test will call you negative.
As people continue to hear about the testing options available to them here in the state of Arizona, what do you say to them who maybe remain on the fence about should I bother doing this?
I mean, I think it's up to every individual and every particular circumstance to decide why they should or they should not. I mean, unequivocally, if you have symptoms, you should check in with your healthcare professional and decide whether or not the viral test is appropriate to see if the virus is actually actively in there. I think that's a no-brainer, and I think that's a really important part of trying to keep the virus under control. The antibody test, I think a lot of it has to do with whether or not you're at a high risk and whether you've had symptoms consistent with COVID-19 but weren't first tested, and what the implications of that positive test may or may not be for you and in your profession.
Dr. Deepta Bhattacharya, thank you for your time.
Thank you, Lorraine.